Beth, you're right. So warm weather does mean it's time to get outside, and that also means that when you're outside, we do tend to share the environment with some little critters that we don't always want to come in contact with, and those are ticks. So Dr. Alicia Daniels is joining us from CHI Memorial to give us a little preview of how to best prevent and then also what to do if we do find a tick. Thanks for joining us.
Thanks for having me.
Okay, so they're most active heading into the warmer months of the year, right?
Right. So spring, summer, early fall, that's whenever you're going to see ticks be most active whenever you're outdoors. So that's whenever you need to kind of be aware that they're out there.
Right. So a lot of people get really scared and they may find a tick on their body and they instantly, I hate to use the word freak out, but they freak out, right? And we've heard about Lyme disease and Rocky Mountain spotted fever, but those are very rare cases, right?
Right. They're very rare. Though the warmer months are the most common times that you see ticks, we really focus on May through July. That's when ticks are the most active throughout those 3 seasons, and then the most tick-borne diseases are transmitted during those months. In the state of Tennessee, we are at risk for Rocky Mountain spotted fever is the most common one that we see, then ehrlichiosis, and then most rarely Lyme disease, although that's the one that people are most familiar with. Right. And then, so with that in mind, of course, when you're outside playing with your children or hiking or camping, you want to take a few measures to kind of protect yourselves and your family.
And so what do we need to do to prevent ticks?
So there are a few steps you can take. One is kind of being aware of your environment, so avoid high grass or brush where ticks might be most frequently found. You want to use insect repellent, so something that contains DEET. So 20 to 30% DEET is safe to use in children over 2 months and effective as insect repellent, or you can soak your clothing or tents in permethrin. That's safe as well and effective for several hours. The other thing you can do is wear long sleeves and pants, ideally tucked into the socks, which is, not a great fashion statement, but it's safest to keep the ticks from crawling.
Especially if you're in a more wooded area where they're more likely to be. Where are they more likely to live and breathe?
Right. If you're hiking and it's really dense brush, you really want to stay to the trails that are marked, but because if you're kind of forging your own path and pushing brush out of the way, that's where they're most likely to be. So that's one thing you want to avoid. And then if you're coming in from a hike or in from a wooded area, you want to make sure you change clothes immediately and take a shower to kind of, if there was a tick on your clothes, that way it's not going to get on your body. And this is the time, of course, whenever you want to do a full body check of yourself and your children to make sure that you don't see a tick, and particularly focusing on areas where there might be creases, so behind the ears, under the arms, between the legs, behind the knees, those kinds of things.
And if we do happen to find a tick on our body or our child's body, we just need to remove it, right?
Right. So don't freak out if you do find the tick. So if it's not attached, then it can easily be washed off in the shower, or you can often just pick it off. If it is attached, you want to find a pair of tweezers and ideally attach them close to the skin as possible, and then gently pull kind of in a perpendicular motion. You don't want to twist or go at an angle, and you ideally don't want to crush or squeeze the tick. And usually you can easily remove them that way.
Okay. And if we need to, what is the main sign we need to look for if we need to contact a doctor?
So the first thing to think about if the tick was attached is to kind of look at it. Is it a very, very tiny one, or is it a more adult size one, a bigger one? And then to see if it's kind of engorged, meaning the tick kind of had like a blood meal to transmit disease.
Is a fever a sign that we maybe need to call?
It can be, but you want to think about how long was the tick attached. Was it there for longer than 36 hours, and was it engorged? Because that's when you could be worried that it could have transmitted disease.
All right.
The symptoms to look for would potentially be fever, or there are a couple of classic characteristic rashes to look out for.
But in worst case, if you do happen to freak out, give your doctor a call,
yes,
right?
Definitely. So after the tick was on your body, if you do see a fever in yourself or your child or a rash, and I think we have a couple pictures of the classic rashes, then you'd want to give your doctor a call.
Dr. Daniels, thanks for joining us, and thank you for the information.
Yeah.
I feel much better going out into the summer. Stick around, we'll be right back.